Okay, welcome back dear friends, I am Dr. Klim Raza. You may have heard about this triad, yes, Ptosis, Miosis and Anhydrosis, or you have heard about Horner syndrome. So today we are going to discuss what is basically Horner syndrome, why this is referred as Ptosis, Miosis or Anhydrosis. So you should remember that Horner syndrome is loss of sympathetic innervation to your face. So sympathetic innervation to your face, it's basically coming from your spinal cord, and which part of the spinal cord? From C8 and T1 segments. So you should understand this. So if suppose you are having any problem here at the level of C8 and T1, it might be the late syringomyelia, it might be Brown-Séquard syndrome, or it might be anywhere along this tract of your sympathetic chain. It might be lungs cancer, pancreas tumor, or it might be the lesion in case of your brainstem injuries like in medullary syndrome, lateral medullary syndrome, pontine hemorrhage, any tumor which is compressing this pathway, which travel ascends through your basically neck, and then it enters to your face, and it supply important areas of face, especially the sweat glands. It supply to the dilator pupillae muscles also, which help in the dilation of the pupil also, and then it also supply this small muscle in this upper eyelid, that is called as superior tarsal muscle, and that is a smooth muscle, and smooth muscle is innervated by sympathetic nervous system. So if you have got all these problems, so it's mean you are going to lose the innervation, the sympathetic innervation of the face. So this is called as Horner syndrome, or this is in short called as sympathetic denervation of the face. So what will happen if there will be sympathetic denervation of the face? First thing, ptosis. What is the ptosis? Ptosis, it means partial drooping of upper eyelid. Remember that this eyelid, the upper eyelid, is basically the major muscle is the skeletal muscle. There is the levator palpebral muscle that is basically innervated by another cranial nerve, but a small amount, only 5% of muscle there in with the upper eyelid, that is superior tarsal muscle. So superior tarsal muscle is smooth muscle, and if there will be injury to the superior tarsal muscle in case of injury to this sympathetic chain, so you will have got partial ptosis, and this is called as partial drooping also, which is common in Horner syndrome. Secondly, meiosis. What is meiosis? Meiosis means constriction of the pupil. Why constriction of the pupil is common in case of sympathetic denervation? Because we know that in intrinsic muscle of the eyes, there is a muscle which is called as dilator pupillae, or dilator pupillae, which is innervated by sympathetic nervous system, dilator pupillae muscle, and this muscle help in dilation of the pupil, and sphincter pupillae is innervated by third cranium, which is innervated, basically help in constriction of the pupil. So if you have got injury to the dilator pupillae muscle in case of injury to sympathetic nervous system, now it's mean your pupil is permanently constricted, you lost the dilation of the pupil. So that's why this is called as meiosis, constricted pupil. Mydriasis, this is dilated pupil, you should remember like this. Then anhydrosis. What is anhydrosis? Anhydrosis, it's mean loss of sweat. Loss of sweat. So loss of sweat, especially if you are having injury on the right side, it means you are having denervation of the right sided face sweat glands. So anhydrosis will be on the right side. If you have got injury on the left side, you have got anhydrosis on the left side. So you should remember that. That's why this is referred as ptosis, meiosis, anhydrosis, Horner syndrome. The problem is there that there is basically loss of the sympathetic function of your face. It might be ipsilateral, it might be bilateral. Thank you for your consideration.